I'm Dr. Scott Spear, and you're watching the Plastic Surgery Channel.
Welcome to Plastic Surgery News. I'm your host, Deanne Moore. Thank you for joining us today. In this week's report, we'll find out what kind of surgery is best for those suffering from crippling arthritis and when to get it. Then we'll zoom in on a story of plastic surgery so dramatic it could have come from a movie. And we'll find out how America's favorite teenage witch beat the bulge and got her charm back. First, the news. Earthquake intensity is measured on the Richter scale. Gasoline quality is measured on the octane scale. Now a team of researchers have developed the first standard scale to measure the skin's aging process. It's called the Mertz scale, and it's designed to create a standard means of quantifying the effects of aging on skin, a universal language of aging. The Mertz scale was introduced this spring at the American Society for Aesthetic Plastic Surgery's annual meeting in Las Vegas. We asked Dr. Corey Moss, a Mertz scale investigator, what the new system means to the average patient.
Well, the development of the Mertz scales came out of really an apparent need, and I think a lot of investigators in other clinical trials had been discussing the relative absence of any kind of standardized methodology for measuring wrinkle improvement. And Mertz came in and really got in the lead of this and created a panel of expert physicians that were able to get a consensus on scales for wrinkles in different areas of the face. Initially, consensus was built around what the scales would look like and what the parameters would be for the severity ratings, and then went back and tested and retested to make sure that those scales and the grading severities that we had developed were reliable and statistically reproducible.
The Mertz scale's creators hope that the rating system will serve as a stable platform for describing the condition of a patient's skin, making diagnosis and treatment more effective.
The way that these scales will help all of us is if we can talk in the same terms, in scales that are universally accepted, both amongst ourselves in terms of evaluating products that impact aging and wrinkles, etc., and or technologies and or procedures that we do, not just products. I think we'll be able to be a lot more clear about what outcome measures we can expect or what we're seeing with these different treatments. Similarly, with patients, if we have scales that are more widely accepted and easy to discuss, which I think these scales are, I think it's a lot easier for us to put outcomes in a framework that patients understand. So the scale development project has both a functional academic sort of use and then more of a practical clinical use that I think that all of us will find valuable.
In our next story, rheumatoid arthritis, or RA, can be agonizing. For those who suffer from this degenerative illness of the joints of the hand, life can quickly become a nightmare of pain and eventual deformity as the disease worsens. However, one variety of the disease, metacarpophalangeal joint disease, can be successfully treated by means of plastic surgery. Doctors can now restore function and dramatically reduce pain by reducing the diseased knuckle joints with artificial joints made from silicone plastic. But the procedure is not without controversy. Some rheumatologists, physicians who specialize in the treatment of joint diseases, disagree with hand surgeons over when such replacements should be used. Rheumatologists involved in the disputes think it's better to wait until the later stages of RA to do a joint replacement. Hand surgeons believe in earlier intervention. Both groups agree that surgical treatment is good for the patient at any time. But when is the best time? A new study, the largest of its kind to date, says that sooner is better. The study looked at the outcomes of 70 RA patients who had been through joint replacement surgery. These patients were separated into two groups. One group, whose joint replacement operations took place during the early stages of the disease, and one group who received the implants to replace advanced deformities of the disease's later stages. The results of each patient's replacement surgery were examined 6 months later and again 1, 2, and 3 years after the surgery. The exams showed that both groups of patients benefited from surgery. Their hand deformities had become less severe over 3 years. However, the group of patients who received the surgery during the advanced phase of the disease still had significant deformities. Doctors determined that the more severe the deformity at the time of replacement, the more difficult it is to fix.
Well, joint replacement has become a big surgery, especially in patients with rheumatoid arthritis. Nowadays, there's a lot of medical treatments for it that treat the disease process well, but patients still go on to having a lot of deformity as well as decreased use of their fingers and hands. Most of it centers around what's called the metacarpophalangeal joint, or MP joint. This study clearly shows that patients with rheumatoid arthritis can benefit from having MP joint arthroplasty or joint replacement, whether it's early or late. It would suggest that patients that are treated early benefit in the fact that they have less deformity that results after surgery than the ones that are treated late. However, it clearly shows that both groups of patients do benefit from joint replacement surgery.
Although the study supports the view that earlier surgery is better, doctors from both specialties agree that a team approach to surgical treatment of RA is best. Coming up after the break, we'll uncover the magic behind a former teenage witch's new bikini body and take a look at a Hollywood special effect that has become a real-life medical miracle. But first, a quick break. We'll be right back.
You've invested a lot of time planning your plastic surgery procedure. You don't want to leave anything to chance. Now, there's an easy way to have peace of mind about your surgery. CosmetiSure. Every surgery has some risk of complication, but most health insurance policies won't cover complications arising from elective surgery. CosmetiSure is an affordable, short-term coverage designed to protect you from the financial impact of possible complications. CosmetiSure is only available through participating physicians. Before your surgery, ask your doctor about coverage with CosmetiSure so you can rest assured.